CİPRO, which is in the anti-infective drugs group, is presented in 500 mg tablets. The active ingredient of CİPRO is ciprofloxacin. What is CİPRO used for? This medication is used to treat a variety of bacterial infections. Ciprofloxacin belongs to a class of drugs called quinolone antibiotics. It works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for virus infections. Using any antibiotic when it is not needed can cause it to not work for future infections. Things to know before using CİPRO. Before taking CİPRO, tell your doctor or pharmacist if you are allergic to it, or to other quinolone antibiotics such as norfloxacin, gemifloxacin, levofloxacin, mosifloxacin, orofloxacin, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist your medical history, especially of diabetes, heart problems, joint tendon problems, kidney disease, liver disease, mental mood disorders, myasthenia gravis, nerve problems, seizures, conditions that increase your risk of seizures, blood vessel problems, high blood pressure, certain genetic conditions. Ciprofloxacin may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. This medication may rarely cause serious changes in blood sugar, especially if you have diabetes. Check your blood sugar regularly as directed and share the results with your doctor. Watch for symptoms of high blood sugar such as increased thirst, urination. This drug may make you dizzy. Alcohol or marijuana can make you more dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Talk to your doctor if you are using marijuana. This medication may make you more sensitive to the sun. Limit your time in the sun. Avoid tanning booths and sun lamps. Use sunscreen and wear protective clothing when outdoors. Tell your doctor right away if you get sunburned or have skin blisters, redness. Ciprofloxacin may cause live bacterial vaccines to not work as well. Do not have any immunizations, vaccinations while using this medication unless your doctor tells you to. Before having surgery, tell your doctor or dentist about all the products you use. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This medication passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. How to use CİPRO. Always follow your doctor's instructions while using CİPRO. Take this medication by mouth with or without food as directed by your doctor, usually twice a day in the morning and evening. The tablet may have a bitter taste if you split, chew, or crush it before taking it. The manufacturer recommends swallowing the tablet whole for this reason. The dosage and length of treatment is based on your medical condition and response to treatment. Drink plenty of fluids while taking this medication unless your doctor tells you otherwise. Take this medication at least 2 hours before or 6 hours after taking other products that may bind to it, decreasing its effectiveness. Ask your pharmacist about the other products you take. Some examples include quinapril, sevelamer, sucralfate, vitamins, minerals, and products containing magnesium, aluminum, or calcium, such as antacids, D-adenosine solution, calcium supplements, calcium-rich foods, including dairy products or calcium-enriched juice, can also decrease the effect of this medication. Take this medication at least 2 hours before or 6 hours after eating calcium-rich foods, unless you are eating these foods as part of a larger meal that contains other foods. These other foods decrease the calcium binding effect. Ask your doctor or pharmacist about safely using nutritional supplements replacements with this medication. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same time every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. What are the side effects of CİPRO? Nausea, diarrhea, dizziness, lightheadedness, headache, and trouble sleeping may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including unusual bruising, bleeding, signs of a new infection, signs of kidney problems, signs of liver problems. If this video was helpful for you, please like the video and subscribe to the channel for support. I wish you healthy days.